it's okay to ask questions. Like, it's okay to just not just accept whatever the doctor says is holy grail. It's like, educate yourself on what the options are. Because if we're not educated as mothers on like what the options are, what's normal, what's not normal, what are the risks, what are the benefits, right? If we're not educated on that, then it's hard for us to be able to ask questions. Welcome back to the What About Mom podcast. I'm your host, Dr. Jessica London here. And today I have a very special guest, Alice. I am so excited for me to introduce her to you so that we can learn from her. But just so you know a little bit about Alice, she's a birth doula herself. She's Lamaze certified childbirth educator with over 20 years of experience supporting mothers and families through pregnancy and labor and birth. And she specifically specializes and really helping parents feel calm and confident and prepared for teaching practical coping skills and decision-making skills and partner support so that families can navigate birth with clarity and really lean into trusting themselves. So we're going to dive all the way in with Alice today. So welcome to the podcast.
Thanks for having me. I'm excited to talk about all these topics.
I know anytime we can talk about mamas and birth and prep and all of the things, you know, I'm on it as well. But yeah, I've had the pleasure of learning from you and just seeing how you navigate preparing women and mostly families. I love the emphasis on families here because I think that so far we see a lot of education for moms, especially moms attending pregnancy visits by themselves and feeling like all of this weight is on them to prepare for birth and to recover and all of those things. So I love your approach to families. What's your take on that? Why do you think it's important to get the partner involved early so that we can support the family as much as possible?
Yeah, I feel like the partner is almost like a secret resource that is being untapped. I think that sometimes they're just an afterthought, and most partners that I work with and talk to, they really want to be involved. They want to like share the burden. You know, they know that obviously she's doing the heavy lifting of growing the baby and their body changes and all of that, but they often want to be involved and want to help, but don't necessarily know. And so that is one of the things that I love is just giving some ideas and sharing how they can help in so many different ways. Pregnancy, for sure, through labor, and then postpartum, definitely. But it's like just a little direction, I think, goes such a long way. And it also sets up that kind of relationship, that teamwork, so that when parenting comes along, there's a teamwork too. And they're already kind of bought in and integrated into this new life and the differences in the beginning so that when parenting comes along, they're also not feeling kind of like an outsider, like, oh, well, she's feeding the baby all the time. I don't know what I can do. But they've already seen like that they actually can do and can help in so many different ways. So I think it's important to get partners involved early, and then they just can really thrive when the newborn phase is, they're really needed so much there as well.
Yeah, you bring up such a great point because I think oftentimes like women, mothers will take on that burden of like, well, I'm carrying the baby. He just doesn't understand. And so it's easy for them to not even purposefully, moms don't purposely try to exclude them, but they also probably feel like, well, I don't know what to teach him or I don't know how to include him in this process, which is why it's so great to have a doula that believes in that process. But I'm thinking back to, you know, my pregnancy birth prep, and a lot of those decisions that we were making were shared and conversationally. And so when postpartum came, he was thrown right in and he was, you know, right into the mix of things. And I hear some of my girlfriends, I'm like, oh yeah, my husband never changed a diaper. So that's where like so much of that mental load and the physical labor, the mental emotional labor that mothers carry is because of this belief system that it's a mother's job to, you know, to nurture the baby and to grow the baby and to provide for the baby. And so it's like, let's flip that on its head and actually get support partners involved in pregnancy. And then naturally postpartum will already have them have skills and assigned tasks and, you know, shared decision making in that aspect too. So I'd love to hear from you, obviously with all of your experience as a doula and a childbirth educator. What are some common ways that partners can feel included? Like if a mom is like, wait, I want my partner included, like where do I even begin? What can they do for me?
Well, one of the it's sort of fun, it's fun and practical ways that I love to suggest partners get involved is for them to sort of take on the role of setting the labor scene and, setting a peaceful environment, setting a comfortable, cozy environment for labor really can help labor along. And if you give partners that task of like talking to her about what brings her comfort, what brings her peace, and then whether that's the practical of, making sure that the playlists are ready to go, or the Spotify, channel is set up, the Bluetooth speaker, whatever. Do they have the battery operated candles? Do they have something, cozy blanket from home? Like all the little details kind of that they can be in charge, especially if they're going to another location to give birth from their home, which most people are birthing in a hospital. Those hospital rooms aren't the most cozy and peaceful. So while, she is in labor and getting checked in and all of that, they can have the role of like transforming the hospital room into that peaceful environment. So I love to kind of start there, introduce that role to partners. A lot of them get a lot of satisfaction and pride that they can do it because it's very black and white. They either set it up or they didn't set up the room, and there's no when do I do it because it's real easy. It's a real easy, do it when you get there and it's ready to go. And so I even sometimes will hear back from some of the families that I work with where the partner will say like, oh, I felt so good that I was able to, set everything up the way we had talked about. And so it's little in a way and it's practical, but it does, go a long way to show that they're involved and they care and they're part of it.
Yeah. Oh my gosh. Okay. Send this to your husband if you're pregnant because that is such an easy win for them. You're totally right. It's such a low lift. It's like, of course, put all the supplies that are supposed to go to the hospital or the birthing center or whatever. What do we want to encourage, a calm environment for mom in a bag? And the only job is when we get there, you're supposed to set the scene. And it just feels like it's such a black and white task. You're totally right. And men really do love, like, tell me what I need to do. They want to be told what to do. They want to be, guided and supported on those tasks that feel more black and white. I'm sure the ones that are probably harder for them is more like of the shared decision making and all of those things that I know you specialize in too. And one thing for me I can share is one other thing that was really helpful for me was like to have my partner also be educated in the childbirth process. Like, how is the baby growing and all of those things too. And as an expert in childbirth education, do you feel like it's also helpful just so that the husband or the partner is educated in what's going on with the mom's body? Right? Just because I feel like that simple thing alone of like knowing how her body is growing as human and all of that she's taking on physically, mentally, and emotionally, just bringing that into their conscious awareness. Is that a big part of what you do with couples as well?
Yeah. I mean, I sort of split childbirth education in two kind of big buckets. One is knowing how birth works. So that's pregnancy and birth, kind of understanding the process. That's a big bucket. And then the other bucket to me is learning skills so that you can deal with labor, deal with postpartum. So I think a class that you're thinking about taking really should cover both. You don't want to just have skills and not really know, what you're experiencing, what birth looks like, and you don't want to just learn about sort of the procedures of birth and not have the skills. But, you have more empathy as well when you know what's going on with your partner's body, when you know that, blood volume has increased dramatically and, you're carrying around different weight and just like your center of balance is off. Like knowing that really can help you understand what someone's going through and just have another sort of perspective of, you see the belly, but do you know the hormone shifts? Do you know, all the other challenges that really go on? It is absolutely helpful. Yeah.
Yeah, absolutely. Yeah, I love that because it's like they're getting involved sooner and they're really able to understand like what's normal and what's not normal and what are signs and symptoms that they
Yeah.
should look out for
Yes.
too. You know,
Yes.
especially in the line of work that we do with women more related to their pelvic floor and core is like, so oftentimes I get on these calls with moms and they're like, yeah, my husband has no idea I'm dealing with this. And it's like, if they don't have the knowledge to even ask, of course they're not going to know, especially if you're not telling them. So I feel like, yeah, even just like things that they can look out for in their partner, questions that they can ask their partner on how they're feeling or if they're dealing with certain things, then they're just way more empowered themselves.
Yeah.
Okay, I'm also curious your take on this because I feel like a lot of times people hire doulas or childbirth educators, mostly if they're birthing outside the hospital system. Because oftentimes like hospitals will have their quote unquote childbirth education course. So what makes you different than the hospital based like childbirth education course? Because obviously it's drastically different when you go outside the current system. You can get a different education, information, support level when you go outside the typical insurance based model in the system. So, what are the differences of maybe like if people are early in pregnancy or they're starting to take some consideration of I should do some education? What are the differences of what they might learn with you versus like just going through the motions at the hospital?
Yeah. Well, so what we see with a lot of hospital classes is that they're often, I should say, often taught by employees of the hospital, whether that's a childbirth educator that works for the hospital or it's a nurse that works for the hospital. So when we see that, the classes kind of tend to be focused around what happens at that hospital. Sort of like our hospital policy is this. We usually see patients that do this. You know, it's a lot about sort of how things are done at the hospital. There's time that's spent on check-in and sort of some of the logistics of, you know, what's available there, which isn't necessarily bad, but we only have a limited amount of time sometimes in those classes. The classes are usually shorter when they're taught at the hospital too, tend to be, not always. There's some differences. When you take a class that isn't affiliated with a location, you tend to get more of a, almost like if you were at a cafeteria and you saw the whole menu, you know, not just a subset. You saw all the options out there, even the secret menu items, right? So when you're taught from a childbirth educator outside of the hospital, you find out certain things, and sometimes you find out what it looks like in other birthing locations. And I've even had families kind of take a look at their options a little bit differently. And do they really want to be with the provider they chose? Do they really want to be with the hospital that they chose or the location that they chose because they didn't know there were other options out there? So I would say that is a significant benefit to being outside a certain location. Yeah.
Right. Yeah. Because it could be skewed, right? Like the information that you're
Totally.
getting in a hospital-based childbirth education class is going to be skewed to that particular hospital, number one, but then secondarily, typical like hospital-based births. And also what those provider preferences are too, because I'm sure
That's right.
that there also might be passed down of like, oh, well, if you're with this doctor, then they're probably going to do X, Y, and Z. And if, and you know,
That's
more
right.
like those standard procedures versus actually learning more about the body and how it's evolving and
Yeah.
what's safe and what's not safe. It's more just based off of education on our policies and procedures and also like what we'll do in certain situations and all of those things. Did you want to add anything else on that?
Yeah, I was just going to share an example. You know, in one city, you might have, you know, two hospitals that have the option of using nitrous oxide or laughing gas in labor, and two hospitals that don't. And so, if you were taking just a childbirth class at one of the hospitals that didn't offer that as an option, you might not even know that's an option. And maybe that is something that you would like to have as an option in your labor. And so taking a class, you know, from not based on the hospital really gives you more of an idea of what's available, helps you maybe see your birth a little differently and maybe make some other choices that are work better for you and your family and your goals.
Yeah, absolutely. I think majority of what we see, especially with the clients that we work with, we tend to see moms that are birthing outside the hospital, chosen whether it's home birth or birthing center births. We see them primarily, hiring the doulas and childbirth educators outside of that because they feel like, oh, I'm going unmedicated, so I need more resources and more tools. But also, there's so much value in taking, an outside the hospital-based childbirth education class that you can still apply, even if you're choosing a hospital-based birth, even if you're choosing epidural to gain those skills and tools and resources, right? Would you agree with that?
Absolutely. I would say the majority of my students that take my classes are birthing in a hospital and are considering, different types of intervention or, want to know so that they have those options as well. And they have the knowledge about intervention, whether that's an induction or an epidural or a cesarean birth. Yeah, for sure.
One of the myths that I had to break myself, even, I know you obviously, we personally have talked about this offline, but I feel like for me, when I was preparing for my first birth, was preparing for a home birth, ended up not having labor go exactly to plan, ended up, transferring to the hospital, had a C-section my first birth, and then second baby had a VBAC at home and all of the things. But one of the things that I was so uneducated about, and this was like prior to Pelvic Health Jessica, right? After my first baby, was at the beginning, we had an extra set of like midwives at home. And I remember the home birth midwife being like, hey, I can leave. Like one of the student midwives can stay and act as your doula if you want. Because I didn't hire a doula for my first birth, which was so wild. If you're listening to this, like hands down, best investment I've ever made was to hire a doula and do more outside the hospital birth education for my second. And I think that really did help me prepare and plan for my VBAC at home. But in the moment when she offered that, I was like, just more bodies in the room. Like I just was like, no, just let my husband and I like do our thing. And it was one of my biggest like quote unquote regrets, right? Thinking back of like, man, it would have been really nice to have this additional person outside of my little unit to be there for like education and guidance and support. So I feel like for me, I didn't quite understand like what was the doula's purpose, prior to whether they're doing virtual support and education or in person. Where do you see the differences between a doula and a partner support? Like what are those big differences that people will really recognize the value of having both be integrated in the process?
I need to develop a good analogy for this, but the doula is the expert, right? The doula has been there. The doula has seen birth. The doula knows about birth, knows how birth works, almost like the guide on the trail. They know all the potholes. Maybe they can't foresee the potholes, but when they see one, they definitely, know that there's one there to show you. And the partner, they know you best. They can see if you're in pain. They can, do comfort measures. They have a lot of knowledge on you, but they, maybe been through birth one or two or a couple times, if ever. So they don't really have that knowledge of like, they can't necessarily see like 2 steps ahead, like, oh, labor is slowing down. Let's suggest this or this. It looks like, this might be a challenge. Let's change positions. They don't necessarily have just that experience and knowledge to necessarily give some of those more tactical kind of suggestions. And also partners are awesome at support, but they also get tired. Like it's great to have another set of hands, like where they can, take a quick nap or don't just feel the burden of having everything, that to sort of manage and juggle, that they have someone else who they can like ask a question to, or, like, am I doing this right? Or even mirror their emotion. Sometimes I think partners, if they see something happening and they get worried and, they can look to the doula and the doula's calm or they're like all of a sudden calm, man, when it works, it's really great. It really, and it works, most of the time where it's almost like this dance where the doula is even sometimes just guiding the partner to do the comfort measure. Like,
Mm.
hey, this would be great here. Though it's very common, what you said about your first birth, thinking like, do we really want another person here?
Mhm.
Sometimes it helps people to think about it. If you think about them as like a nurse, like if you knew that you could have a nurse with you in labor that you already knew, that already had that relationship with you, wouldn't that be great? And a lot of people say, oh yeah, that would be awesome if I could pick my labor and delivery nurse. Well, it's kind of like that with the doula. Obviously, doulas don't do any medical procedures. They're outside of that medical treatment. Especially, I mean, in your case, you might not have known that midwife that was suggested to be your
Mhm.
doula at the time, but
Right.
having that knowledge, having that relationship, that goes a long way.
Yeah, absolutely. Especially
Yeah.
building that trust with people. It's almost like the
Yeah.
doula can also be the coach for the dad, right? Or
Yeah.
the partner,
Totally.
right? So the doula can also, yeah, like you said, guide
Totally.
the partner so that the partner's like, oh my gosh, learned this 3 months ago. Like, what am I supposed to do again? In that moment, so they're able to be that guide to support that person. Yeah, that makes so much sense. Okay, so a couple questions for you because these are like burning questions that I think a lot of people are curious about is inductions, right? Like so many moms will come to us and I just don't want to be induced. And we know that there's the cascade of interventions that can also happen, but there's also so much lack of education around inductions and well, my doctor said I needed one, and so then I did it. And I mean, just a week ago, I saw a reel of like some celebrity. It was like, my doctor said I needed one, that I can't go past 40 weeks or else I'm getting induced. And it was just like an automatic, which I think what we talked about previously, sometimes that could be people's hospitals policies, right? And so that's good to know if you're choosing to birth at that hospital that they have a policy in place. What is your take on inductions? Like, who should get them? When should it be okay? When are we trying to avoid them? Since I know inductions is a big topic for so many pregnant moms.
I could talk probably for, for the next week about inductions. Okay. First of all, I think moms are put in such, or families are put in such a difficult situation with induction. I think it is so hard to navigate. So if you're listening to this and you're like, I'm confused what to do, yes, it's very hard and it is very confusing. Induction is, there's the induction for medical necessity, it's a need. And then there's elective inductions. And what's really hard is to figure out which is your situation. And oftentimes, the challenge is that providers are recommending an induction, but it's actually in reality an elective induction. And an induction at 40 weeks likely is an elective induction. And that's what's really difficult is trying to educate families to know the questions to ask their providers. Is this medically necessary? Is this my choice? Is this an elective induction or is it medically necessary? So a scenario that we see a lot that is very confusing and very stressful for families is when their provider says, we need to induce, you're 3 days past your due date. You need to come in on 2 days from now and we'll start the induction. Okay. So even if they didn't want an induction, the family, well, their doctor told them they needed to, and, they start feeling stress and thinking about what's that going to look like. And I wanted to go into labor on my own, but now I'm not. And now I've got this induction ahead of me. And then when that day comes, they might get bumped from their induction because the hospital can't fit them in. And this happens so much now because the induction rates are so high. There's a lot of scheduled inductions, and there's oftentimes challenges with staffing and room at the hospital. And so when their doctor tells them they have to come in for an induction, but then their hospital calls and says they don't have room for them, we might have room for you tomorrow. Then you start wondering, well, now I'm worried because you said I needed to be induced on this day, but now you're bumping me.
So how important
So
was it?
right.
Yeah.
And that causes so much stress.
Mm.
So actually, when I teach induction, I usually teach it in 2 full hours of class, which one is about how it works, like the methods of induction, Pitocin and the balloon and, Cytotec and the types. And then the other is the conversation about really when it's necessary and when it's elective. And if it's something that you know that you aren't interested in or you want to avoid it, I would start that conversation with your provider as soon as possible, even though they might even say, oh, we don't talk about induction now. Asking questions like, what percentage of your patients are induced?
Right.
What are the reasons most of these inductions happen? Because strangely, it can vary so greatly from provider to provider, even in the same practice,
Yeah.
even in the same
Wow.
hospital, even in the same practice. People will see one provider in a practice that will say, oh, we will induce you at 41 weeks. That's when we generally, say is the safest. You can go to 41 weeks. And then you'll see another doctor in the practice, a couple weeks later, and they'll say, no, we usually 40 weeks. So it can even differ in practices. So it is hard to navigate. My last thing about induction that it's so important, I think, that people should know is that what's not talked about is induction is often a lot longer. So it usually ends up being a whole night extra at the hospital often. And when you spend even more time at the hospital, you start off your parenting journey very just sleep deprived and exhausted.
Oh, yeah, they're coming in every 15, 20 minutes to check in on you. You can't sleep at all at the hospital, even after the baby comes.
So hard. It's so hard. So it sets you up with that challenging start to, all the things that you have to do with a newborn, feeding and your own recovery. And I think that is not really talked about when you're weighing like the pros and cons of whether you want a scheduled induction. If you have the choice, I think it's something to take into account.
Yeah, it's a serious choice. It's not something to take lightly. And even just with the last minute changes that can happen of like, oh, we need to induce you on this day. And thinking about too, the ripple effect of that. If this is not their first child, sure, it's a lot easier if it's your first child. But typically if you have one or two or three kids at home, then there's a lot of coordination that's also going on in the back end to have friends or family or grandparents come in to be able to support those younger little ones if you are going to the hospital for an induction. So yeah, I'm glad we're talking about this. And I think what keeps circling back is just this, there's two parts to obviously preparing for birth is like educate yourself on what the options are. Because if we're not educated as mothers on like what the options are, what's normal, what's not normal, what are the risks, what are the benefits, right? If we're not educated on that, then it's hard for us to be able to ask questions back to the provider, right? So it's like education number one. And then number two, what I'm consistently hearing from you as well is it's okay to ask questions. Like it's okay to just not just accept whatever the doctor says is holy grail, because oftentimes the doctor is just skewing what their personal beliefs are, what their mindset is, or what their fears are in birth, or what their past experience is. And, of course, doctors say up to date and educated as much as possible, but also there are a lot of people who get stuck in their own ways as providers. And so sometimes things that were common 10 years ago, 15, 20, 30 years ago, if that provider's been practicing for a while and they're not staying super up to date on what those current, research and literature and how family dynamics are changing, then you can also get stuck with somebody who says, oh, you need to do this, you have to do this, and realize that you don't have a choice. Oh my gosh, well, of course I want to protect my baby, whatever I need to do to protect my baby, without one, being educated, without two, knowing what questions to ask to confirm, is this really in the best interest for me and the baby and my family?
Yes, so well said. Absolutely agree with that. And just to add one more scenario that I've seen is sometimes providers are making suggestions based on what a lot of their clients want, but not what you want, or even what they think is the best thing. Because I've talked to providers that say, oh, yeah, most of my patients, they want to be induced. I'm suggesting it because I hear that people are tired of being pregnant. They want to be induced. So that's why I suggest it for everyone.
Wow.
I'm offering it. They think they're offering it, but their patients think that that's what's being recommended.
Right.
So without having that question or feeling comfortable enough to say, is this an option, or can we talk about the benefits and the risks and, the alternatives? And sometimes just saying, is this an option? And then they say, yeah, yes. Oh, if you don't want that, that's fine. But without like initiating that conversation, you don't know that you have options. So
Yeah,
yeah.
and there is true like studies that have shown that induction increases around holidays and those types of things. So I think there is a lot of great questions to be asked about like, is this a medically induced necessary induction? And then even just feeling okay to not question your doctor. It's not like in a negative way. It's like for your own empowered way of knowing like why are you recommending what you're recommending, and it's okay to ask those questions. Is actually your informed right to be able to know what is being done to your body. I'd love to hear your thought process, and we should just keep rolling with the induction talk because I think it's such an important conversation. Is when clients are induced, they call it the cascade of intervention. So will you explain what the cascade of interventions is and like what are the risks involved with induction as well, just so people do feel educated? It doesn't have to be a scary thing, but at least they're educated in what the risks are and what the cascade of interventions, what does that mean?
Yeah. So cascade of intervention is, it's almost like if you can set up a bunch of dominoes where when one falls, it's very likely that several more are going to fall. Induction requires a few intervention where there's the method of the induction, and then whether that be starting with cervical softening like a Cytotec or a Sorbidil, or to cervix opening like a balloon, catheter, or Pitocin. So whatever the method the induction is going to begin with, there are certain requirements that have to go along with those. So you get those dominoes fall, such as continuous fetal monitoring is required with an induction because it increases risk of possible uterine hyperstimulation. So the uterus is working too hard and the baby doesn't tolerate it. The baby doesn't like what's happening. So you have to be monitored continuously. So you have to have monitors on. And then several of those also, like with Pitocin, you have to have an IV and you have to have continuous medication infused. So that's an extra intervention that happens. Some research has been published fairly recently that said that when you are induced, that you are more likely to choose an epidural for pain management and more likely to choose an epidural earlier than non-induced. And so with an epidural, those also come with their own intervention, such as a urinary catheter, because you can't go to the bathroom on your own. So that also happens. So that's what that cascade means. It's that it's not just induced, it's induced with the next and the next and the next thing. And as we introduce more intervention, there are risks associated with each. A lot of them are low, like urinary catheter. Risk of that might be an infection, bladder infection, because anytime we insert something into our body, we have a risk of infection. That is a very low risk, but it is risk. So it's, something to remember, thinking that all the way through. Now, granted, a lot of times we don't have choice, right? Medically, there are medical needs, and we're glad that we have all of those options. And asking the questions of, okay, well, if I am induced, what's the method going to be? Do I have any options? What are the risks of it? And just knowing how to ask those questions, they will help you feel more informed about your care. It usually helps people feel more ownership of the experience and less of kind of being like this, directionless kind of experience where they're just kind of being told what to do and pushed through the system. That usually doesn't lead to a high birth satisfaction. Like being an active participant in the decision makings, that patient-centered care that you hear people talk about a lot, that's really what can lead to a positive experience, even if we end up with all of these interventions that maybe we didn't want. If we feel an ownership and an active participant in the process, and that we're being listened to, that our ideas and our fears and our preferences are being taken into account, that makes a difference too. And that is a piece of what education can bring, can help you learn those communication strategies.
Yeah, absolutely. I mean, we can't plan birth, right? There's no birth that's like perfectly planned from start to finish, but that's exactly right, right? If we are educated and know what our options are and we feel a part of the process, we can significantly reduce birth trauma and the feeling of a traumatic birth experience if we do feel like we were a part of the process and a part of the shared decision making, and we were heard and we were validated and we were seen. I know, I'm sure in both of our lines of work where we feel like, oh my gosh, moms are saying it's such a traumatic birth, it was so crazy. It was because they felt so out of control and they felt like all these things were being done to their bodies without their consent. And they did, in the moment, they didn't really have time to process and understand and be a part of the shared decision making. And then later they thought about it and they're like, oh my gosh, I can't believe it is traumatic when all these things happen to your body so quickly. In the moment, you don't feel like you have the ability to make the decision. And of course, there's, medical emergency things that happen very minimally, lower part of that percentage where, yeah, there are going to be times where, a decision needs to be made. But majority of the time, there is time to pause. There is time to ask questions. It's like majority of the time, there is time to be like, let's make sure that we're patient-centered here. Let's make sure the whole family's on board. Majority of the time, it's not like this, oh my gosh, 0 to 100 emergency. We have to make a decision now. And even that comes down to, like, of course, I'll speak from the pelvic floor perspective of like, during the pushing phases of like, oh, we have to do an episiotomy or we have to use forceps, and when we can avoid those interventions, we can reduce the pelvic floor dysfunction greatly. But sometimes moms don't know what they don't know. So part of that childbirth education process, which is so important, we always recommend all of our clients, like, we will get you covered on the musculoskeletal side of things, some pushing, some like vocal tones and those types of things. But we encourage all of our pregnant mamas, like, please take a good quality childbirth education course, because it will allow them to feel so much more educated going into birth and have the decreased risk for the trauma or perceived traumatic experience even after birth themselves, and reduce complications too. So I just so appreciate the work that you're doing and how passionate you are, and so consistently over 20 years. If you loved learning from Alice, you will definitely have to check out her YouTube. I will go ahead and link it in this episode for you as well, because there's so much incredible knowledge on there over the years.
Yeah. Thank you.
Of course. And then also I want listeners to know, like, how do they find you? I know that you are, you have some one-on-one, like, VIP level support as well for clients that maybe don't have access to resources locally. They prefer a virtual option. Obviously, we're 100% virtual. So I'm such a believer in being able to provide mothers and families with support virtually, especially when it comes to being customized and personalized. How do they get a hold of you, and what's the best way for them to learn if they're interested more in that one-on-one VIP level support?
Yeah, that I would love to share more. The best way is to book a call with me, and the easiest way is just my name, aliceturner.com. And yeah, it's so cool to be able to work virtually, and it's so common now, right, to be able to connect, and it saves so much time. Just jump on and talk, and it's really been a cool journey to merge kind of in this, working with clients in this way is really kind of like education and doula services combined. And I love that, because it's the best of the two things that I feel really get you prepped. So, yeah.
And I love that. I mean, especially because you emphasize partner support so much too. Like, virtual just makes it so much easier for two partners to be able to, even if they're not in the same room, it's like husband's stuck at work, mom's at home logging in. It's like everyone's in on the same call, because it is really hard, especially for families that have, even if it's a first child or multiple, it's hard for people to get to multiple appointments in person at a very specific date, a very specific time, and childcare needs. So yeah, anything that we can do virtually to really bring families stronger together. So yeah, I definitely recommend you looking up Alice Turner. Of course, anywhere, we'll drop some links for you as well. But thank you for being a wealth of knowledge and sharing your passion in childbirth prep and doula work too.
Yeah, thanks so much for having me. It was lots of fun.